So one of my primary goals is to reduce metabolic inflammation and avoid the preventable complications from insulin resistance. What I want to do is I want to get patients back to normal glucose regulation. And we do that by reversing their insulin resistance. We looked at this as a disease modification. And we know that if we do that, we will get a reduction in mortality, all cause. These are indicators that we aim for, and we really look at getting patients with hemoglobin A1c to below 6.0. Even though we don't really consider diabetes till about 6.4, pre-diabetes is between 5.7 and 6.4, but we know that the vast majority of significant inflammatory issues in these patients occur in these lower, technically acceptable, untreated areas. And in order to really get ahead of the situation, we try to keep our patients with relatively low insulin levels and keep them returning back to normal glucose excursions. The issues that we see, not infrequently, is that they start to develop neuroinflammation. And neuroinflammation, as this study documents, which was done with SPECT analysis, published in the Journal of Alzheimer's in 2020, shows that there's a significant decrease in blood flow using SPECT analysis, even in overweight patients or obese patients compared to normal weight patients. And we know that this is the single most easily identifiable biomarker for progression onto Alzheimer's disease. People with obesity, though, experience a very significant amount of weight bias, and our personal bias can affect our ability to deal with patients. And this is something that we really had to come to terms with. There's a couple of issues here. One, if you have a provider that's massively overweight, they may not give you the best advice. In fact, we know that. There's been studies that show that it's highly unlikely that a provider who believes that their patient is less fat than them will even counsel that patient on appropriate dietary intake. And it's also highly likely that if a provider is massively overweight, they may not know the right course and therapy. But then on the other side, we get into this weight bias where we have providers that are thin, that are healthy, perceiving themselves as healthy, and they probably are healthy, but that bias that they have internally creates a discord and disconnect between the patient. So we have to have a introspection. We have to examine our own belly buttons first. We have to understand the context of the patient. We have to have a fundamental understanding of the biology, the genetics, all of those social determinants of health. And we have to recognize our own biases and see how they impact our ability to interact with our patients. If we fail to do that, we haven't done our patient a service. And that's just as bad as failing to help them in the first place with their weight. Now, our food system is a very significant contributor to this issue. Our food system was born of policies for national security concerns in the 1940s. We had tremendous droughts. We had issues, the Great Dust Bowl. What we were trying to do was maintain national security. And so we created a subsidiary system, a subsidized system, where we would transport processed foods from the Northeast to the Southwest. We would put them on trains, and we needed a way to get food distributed across the United States for the purposes of national security. Unfortunately, those subsidies continued, or fortunately, those subsidies continued. It depends on your viewpoint. We did this initially because about 40% of the military recruits were ineligible for service because of malnutrition. They were underweight. Now, over 70% of Americans can't qualify for military service because they're overweight. We have the malnutrition of excess. So our food policies, which were very beneficial for us in the 1940s, for national security purposes, have become a very significant portion of our current demise. And the other reality is that the U.S. only has about 4% of the global population, yet more than 25% of the global mortality associated with COVID-19 is present here in the United States. These are significant indicators of poor quality diet and poor nutrition. The subsidies enabled mass production, and it allowed stockpiling of food in preparation for food scarcity for the next global conflict. That global conflict is upon us right now with COVID-19, but unfortunately, our food system is not adapted well to deal with that global conflict. If we look at our food system and we look at how well it was efficient at delivering a product, it's functioning exactly as intended. But the problem is the efficiency comes at a cost. The efficiency comes at a shelf-stable production. So we have a ton of carbohydrate and we use omega-6 fatty acids or vegetable oil, which are shelf-stable, dehydrated, acellular, and it allows the food to be on the shelf for a long period of time without spoilage or without going rotten. But the problem is that lacks nutritional sufficiency. If you look at supplemental nutrition plans, or basically SNAP benefits, which is food stamps, about 10% of every SNAP dollar goes towards the purpose of purchasing a sugar-sweetened beverage, which is about $7 billion a year, which is a subsidy to the sugar industry. About 2/3 of people that receive SNAP benefits are on Medicaid, and this 2/3 of people has a much worse outcome than the general population, and they're less likely generationally to ascend the economic ladder and get out of Medicaid and get out of poverty. Now, this may be an epigenetic effect because we know about 8% of the genes that we have are edited by our diet. So the reality is the food system is not really broken. It's functioning exactly as intended. It was initially produced to have extreme efficiency. It was not optimized for resilience or actual nutrition of the individual. It was designed for the war situation, and the war situation in which we needed to transport large amounts of food that were shelf-stable from one part of the country to the other and feed temporarily. But it was never intended to last generationally. It was never intended to provide perfect nutrition. It was intended to provide some nutrition. So it's functioning as we intended it to, but unfortunately our intent doesn't meet our current needs. So what's the future? The US, 85% of adults will be overweight or obese by 2030. 99% of adult female African Americans will be overweight or obese by 2025 to 2035. About 80% of the patients will become overweight, will become insulin resistant, pre-diabetic, or diabetic. And the reality is about the average cost of insulin therapy is greater than $800 per month. The reality is that each patient that becomes insulin dependent costs us about $10,000 in US dollars per year. And this doesn't even include the cost of renal dysfunction. This doesn't include the cost of dialysis. This doesn't include any of these other costs. Right now, obesity and insulin resistance probably comprises between 1/3 to 2/3 of our national healthcare expenditure. And it's about $1.7 trillion a year. We can expect that to balloon dramatically, and it's going to get significantly worse. And it's not going to affect just a small population of the patients. It's going to be over 85% of the population by 2030. This is pretty significant. And this brings in mind one of my favorite quotes from Kurt Vonnegut. Nice, nice, very nice. So many different people in the same device. We're all caught in the same food system. We have to break out of this food system. I recontextualize food for my patients, and I have them understand that food is just not food. Food is nutrition. Food affects emotion. Food affects addiction. Food provides instruction for the body. And the reality is that about 8% of our genes are affected by environmental edits that stick with us for life, and they may stick with generations forward. These edits are significant. We have to change these edits in order to make a significant difference. It's the overlap between obesity, pain, and addiction driven by metabolic inflammation that we treat in our center. If you have any questions, please feel free to reach out to me. We don't sell anything. We give our protocols away for free. If anybody has any questions, please give me a ring. Thank you so much.